Welcome to These Kids Can't Wait, discovering the world of rare disease. Welcome to These Kids Can't Wait. Today's guest is someone whose voice I've been looking forward to sharing with you, Dr. Candice Wood. She's an OB-GYN with a specialty in women's mental health, and she's also the founder of Women Made Well, a beautiful practice for women navigating both physical and emotional challenges. Today, we're talking about how mental health and medical care intersect and how Dr. Wood is redefining what healing looks like. Welcome, Dr. Wood. Dr. Wood, tell us a little bit about yourself and what led you to practice medicine.
Well, I have a father who's an obstetrician gynecologist, and he was probably my biggest hero growing up. And so I think it was very early on. I think I was saying wanted to be a doctor and take care of people since I was like 7, 8 years old, always through high school. That was my goal. I just fascinated with the human body and learning, and I love helping people. And I felt like there was no better way to do it than if I could help them with their physical, mental health problems.
Can you tell us how your passion for women's mental health developed?
Well, I think most people who know me pretty well would, at least my patients would tell me as somebody who I love to listen to patients, and a lot of my partners often would say that you probably should have been a psychiatrist because I was interested in all the things that were leading to what was going on in their life and all the facets of their life. And so I got to know my patients really well. And when you do that, you actually get to see the side of them like real life. The mental load of life is quite heavy. And the transition to motherhood specifically, when you think 1 in 5 will have clinical depression or anxiety postpartum, that's a high number. And so I got to see a lot of it. And then I experienced postpartum myself. And since I'm close to a lot of my patients, I talked to them about things I'd experienced, and then it opened the door to me realizing like everybody really struggles with this transition. It's not just me, it's not just them. And then there are certain people who really struggle at the clinical level. And there were some specific cases where I felt so passionate about helping women realize their strengths, fight through the struggles they were having in order to be the moms they wanted, that I realized that this is where my passion was. And it was a underfilled there weren't people filling this need. And so it was clearly something easy to dive in because I needed the skills so I could help the patients that I was finding.
Yeah. Is that what led you to start Women Made Well?
Yes, I wanted to make the change from just a private OB practice that was focused just on women's health, which is clearly very important, to one that was a space that still did that, but was really focused on the mental health aspect, which, overshadows so much of that, and made a space where we really were truly focusing on making the whole woman well.
Yeah. And that's different than your traditional care setting for an OB-GYN, correct?
Yes, unfortunately, a traditional setting, you're seeing a patient for an OB check for 10 to 15 minutes max, and there's not as much of an opportunity to make the connection or talk about the struggles in pregnancy, the struggles postpartum, the struggles in trying to become pregnant. And so I wanted to make a space where I could still answer questions about other things, the typical medical needs that you have in a pregnancy, but where they had a space to discuss the things that were actually weighing on their minds a lot more, and really preparing them for postpartum for those women that are pregnant.
How much time do you spend with your patients now?
Well, every patient that is there to talk about the pregnancy, postpartum needs, it's a 40-minute appointment, every single one of them. Sometimes we squeeze in a 30-minute because we just didn't have a 40-minute, but it's 40 minutes, and that's face to face, 40 minutes start to finish. I chart after, unfortunately for me, but that's what I think you need, because a lot of it's the storytelling to figure out where to start, and then it's actually working on some of the things we need to work to get them to reach their goals.
Yeah. And what do you hope women feel when they walk into your clinic?
I think the absolute most important thing for them to feel is welcome and then heard. I think the biggest difficulty I hear with patients and why they struggle in their physician patient relationship is that they didn't feel heard. They didn't feel like the doctor was actually an advocate for them or actually understood their needs. And so they didn't feel like they were in control of the situation. So I hope at Women Made Well that my patients really feel heard and they feel like I'm there as a partner in their health journey and to help them make the best decisions they can for their future and to reach their goals.
I feel like that's so important because a lot of times when I go to a doctor's office or a clinic, I feel so rushed. And then I leave and I'm like, oh, I wanted to bring this up. Oh, I wish I had a little bit more time. So I think that is so important, especially when it comes to women's health and women's mental health. They need to feel heard and
Yeah.
and like their physician really cares about them. So
Yes. And speaking to that too, a lot of the appointments you're going to are the same type of appointments. Several of my patients are going to where it's you're seeing somebody about a specialty, very very refined specialty for your child. And I tell my patients all the time, write all your questions down now because I know as soon as you're in front of that doctor's face, you're going to forget everything, and that's key because you need to be heard and you need to get your questions answered.
exactly. So, what's the most common issue and concern you see women coming into your practice with? Is there something that you find yourself addressing over and over again?
Well, since I opened Women Made Well, it was kind of announced my office to about 18 OB-GYN practices. And I think all those OB-GYNs were so happy whenever any of their patients had any mental health issue to have someone to send them to. But the most common is just the adjustment to motherhood, feeling like they've lost themselves or feeling depressed or anxious postpartum. That's probably the number one thing that I work with women about.
Yeah. And do you see a rise in depression, more specifically postpartum depression? And why do you think that is, if you do?
I definitely feel like I've seen it. And, we still quote that it's 1 in 5 to have postpartum anxiety or depression. I feel like it's definitely that common, potentially more just to different levels. I think it's significantly increased. One of the biggest reasons I think is because of social media. It is, one of my favorite quotes from Theodore Roosevelt is comparison is the thief of joy. And social media allows all of my moms to compare every single facet of their life as a mother to millions of people around the world. And it allows my moms to feel, we already don't feel like we're doing enough. Every single one of us moms always feels like there's something more we could do for our children. But then these women who are on social media see 1,000 more aspects than I even saw when I was first a mom, because you can see they have a better house. They went on better trips. They're taking them to private lessons. Look how cute their clothes are. They're putting bows on their daughter's hair. How did they even get those bows? And so it's just comparing yourself and constantly questioning your ability to meet the needs of your child. And it's it's really painful. But I think that's one of the reasons it's increased.
So, how do you address that? What do you tell these moms?
Well, I definitely encourage moms to see the difference of when they get off social media, to see the difference of how that makes them feel. And then we usually start with the basics of talking about what our children actually need and what actually makes a good mom, where your expectations come from. I think that's really important. And we talk about safe places to let our expectations come from. They really should only be coming from yourself, a trusted partner. I mean, if your a husband or partner is reasonable with their expectations and you've made those together, yeah, we can address those and use those as expectations. But when we're looking outside to friends, social media, or even sometimes parents for expectations that are unreasonable, it leads us to question ourselves. So really figuring out what the expectations are and then actually applying what your children actually need, which is very small. And I think, Erin, you've recognized this. Our kids need to be fed. They need to have shelter. They need to be changed. They need to sleep, and they need to be loved. And all of my moms, I have not yet met a mom. I have this blue couch, this velvet blue couch in my office, and I have not had a mom yet that sat on that couch that was not actually meeting and exceeding their children's needs. But it's rare for me. If I think I've had one woman who sat on that couch that actually gave herself, I always have them rank themselves 1 to 10, 10 being Mary Poppins, practically perfect in every way. I've had one mom give herself a 9 one time. Almost, it's always between a 2 and a 6. Almost always. And these are women who are meeting every single need of their child. So we kind of start there, and then we move to the specifics of what's robbing them from the joy of motherhood.
I wish I had that confidence, the confidence of a 9.
It
Oh.
might not have been the first time she saw me either. I might have, like, helped her earn that 9. I don't know that I've ever had somebody who said 9 as the first time I asked them that question.
So you can get us there. That's good to know.
Yep,
Okay.
yep, it's hard work. It's hard work, a lot of convincing.
Perfect. When women come to you who are struggling emotionally or are working through a traumatic situation, how do you integrate emotional care into what's traditionally a very clinical conversation? We kind of already talked about this before, but do you give them like an emotional toolkit, and send them on their way? What's the first piece of advice you give them?
Well, I think it's really important to recognize that, your emotional feelings do directly affect your physical findings, your physical health. And so I like to make sure they're given space for that. I think it's really important to recognize that emotions are necessary. You're not supposed to not feel sad. You're not supposed to not feel mad. You're not supposed to not feel cheated, frustrated, any of those things. We Emotions are important. You cannot feel joy if you have not felt pain, or the opposite. That's what makes those positive emotions so exquisite, is actually that we felt the opposite. So I think it's important for these patients to feel safe and have the space to feel those emotions and share them. And I make sure they know that these are good. It's good. My treatment is never to make you feel numb. That's obviously not what I'm going for. But the importance, and science shows us that emotions are present and they rise, and if we don't feed them, they will fall. And so it's really what our goal is trying to get to a space where we're not feeding a negative emotion, but we're letting it rise and letting it fall and moving through it, and finding how the feelings in those emotions can be powered to help us reach our goals. And those are different for every patient depending on where those emotions are coming from. In respect to the moms that you're talking to, the families you're talking to, those are emotions that come from a really difficult diagnosis. And, so what is our goal getting through that? That's not something that's going to disappear. It's not something that's automatically going to go away. But the frustration or the sadness that we're feeling, letting it rise and letting it fall, and then letting it power us towards helping our children have reached the potential that they have, and us being their greatest advocates. So we'd be working on those types of goals and how we can deal with our emotions, but also use the power behind that to fuel our work towards our destination.
Yeah, and kind of adapt to that, those situations. When dealing with rare disease, like you mentioned, and conditions that are ever progressing and worsening, what advice do you have for moms who are constantly living in an emotional roller coaster and trying to adapt to those changes in their children's health?
It's so difficult. I've had the conversation with several moms who, one of mine has a baby that is the number 76 in the entire world that's ever had this. So the data on outcomes are limited at best. And so she literally has no idea what to expect for her child's life. So how do you adjust to that? How do you prepare for that? It's very difficult. And so I've read this fantastic book called Mindset that has nothing to do with children with rare diseases, but it's written by Dr. Carol Dweck, and it is basically a hypothesis that she presents that there are two basic mindsets, and one mindset helps you reach your potential, and one mindset keeps you pretty stagnant and will limit you. And that's the fixed mindset. And that's kind of believing that you're either good at something or you're not. And the growth mindset is believing that if you put in effort, get better and you'll be able to reach a higher potential. She proves in the book that a growth mindset, even if you start with less of strength in an area, will get you further and help you reach your potential. It's been a phenomenal book. I was listening it more towards analyzing myself and how I could help my kids have the best mindset. But when I was listening, I realized that this actually was more powerful, or not more powerful, but also could be applied to parenting. And when I have a parent who, none of us know what's going to happen with any of our children, but when I have a parent who doesn't know what's going to happen to the health of their child the next day, or what the possibilities unfold for them just physically. Like, will they be able to ever walk? Will they ever be able to do this on their own? This growth mindset, I like to apply it to parenting in the fact that if you give yourself the grace to realize that as long as you're trying each day and that's all you know you have to do, you can do this. A lot of my parents are afraid of the unknown, which applies perfectly this scenario. Because even babies that do not have rare conditions, they change. You get used to something and then it changes. And you know this, Erin, from your firstborn. You thought you had it down, and then all of a sudden it's a different thing. And it can be very paralyzing because you just don't know what the next day is going to bring. But if you've seen, as I know all of my moms have seen, the growth that they have experienced from the first day of taking care of their baby to even 2 weeks out, they have changed as a mom. They understand things, they've learned things. And so if you embrace that, that's a growth mindset. And if you embrace that to your child's rare disease, where I don't know what tomorrow brings, but I know as long as I keep trying to adjust and change, and as long as I don't stop trying, meaning I don't stop putting in that effort, I will be prepared for it. And from my experience, and this is more like the coup de grace of all that I've learned with women in the situation of your listeners, is they are so much stronger than they ever crack themselves up to be. They rise to the occasion, and I'm going to try not to get emotional, but I can see these women's faces, and I can remember from the day that they shared the diagnosis to me and the fear. And then now, several of them, one in particular, her baby is home from the NICU on a trach, celebrated the first birthday. And I talk to her now, and like, she's the expert teaching me about how to care for a child like this. She could teach she can teach the people who are coming into her house to like service her machines. She knows more about them than they do. And how did she get this? Daily putting in the effort. She didn't, I mean, and she would have never thought she could do the things she could do, ever. And so, yes, you cannot know, and science can't tell you. But if you just commit that I'm not going to give up on this child, it doesn't mean you don't need breaks. And it doesn't mean you don't get to like go cry and wonder if you can still do this. But you take your break and you show up the next day. And I've seen it. These women, these families are absolutely incredible.
So, Candice, one thing I've heard you speak a lot about in your podcast is finding a sense of community. How can these women find a sense of community when they are going through something no one else is, and when they're dealing with rare disease?
Well, I think the most important thing, like you said, is recognizing that you're even without a rare disease, you're never going to find somebody who has the exact same story you do. Whether it's their baby's already 2 years older, or they have 3 kids and you only have four, and you have four. No situation is identical. But then it's when you have a common disease, it's easy to find. Like, if you just have a baby with no genetic issue, but they're in the NICU, there's lots of moms with babies in the NICU. And so there is an instant community. And so yet what you're talking about is when you have a super rare disease and you can't find anybody in the city, like my mom, who's, baby's number 76, like, she's not, even though we live in a big city here in Phoenix, there's no baby that has that diagnosis. And so she's not going to be able to talk face to face. So what do we do in that circumstance? I think it's really important to recognize that your community doesn't have to be somebody who exactly understands your situation. One of my moms was such a good example of this because her baby has, I don't know the numbers on hers, but it is very rare. But her baby requires a trach because the baby does not have the muscle strength to breathe, and was in the NICU for I can't remember, but 4 to 6 months with a trach before the baby could even leave, even though it was a baby that was born at term. So she does not know anybody in the metropolitan area, state, side of the country that has the same issue. But the people she's connected to are moms that have babies that are trached. And so, yes, it's for different reasons, but they all have a common issue that they need to become experts in, and they can grow as a community over that. And so seeking out a community first of all, you're going to start with the low hanging fruit, which is what you're providing for your community. You guys, can find, I know you have been found by internet searches by moms who need that community, and you've provided that. So of course you can reach out to that. There's tons of support groups on Facebook for lots of underlying conditions, lots of rare diseases where you can get connections with people. But when you run short because you're one of those people who doesn't have a support group that you can find, you can look for other moms with babies with some sort of disorder to build that community. Or like my mom did, find mothers or families that have babies that have trachs, so that you have that. Because what do you even need the community for? You need the community to discuss your feelings, to discuss the pitfalls, to discuss, am I doing this right? To have somebody who you're asking a question to, that they have maybe some experience to add to you. Obviously, you can ask your pediatrician, but as you know, in the conversations we've had, it's just different when it's your child. And there's so many other facets. How is it affecting your family? Your pediatrician's not going to be an expert on how this affects families, but if you talk to another mother who's maybe 3 months ahead of you and also has some children, how have you balanced, like, still meeting the needs of your other kids while you're trying to meet the needs of this child who needs 180 million% of you? And so that's why we need community. But it is difficult, and you just have to try. And sometimes we can find direct fits. And like, I think you're blessing so many people's lives by what you're doing. But other times we have to finagle it because our disease is so rare, and just find community with women who are also struggling with something like this.
Yeah. And that goes right into my next question. So, hypothetically, say you had a mom with 5 kids, one with a very rare, complicated medical history, who is about to go through a bone marrow transplant. This is going to be a period of isolation, pain, confusion for the family. What advice do you have for this mom who will be in isolation for, 4+ months?
Let's all take a deep breath before you even think about the advice. That's what she's going to need to do a lot. I think it's really important. And this is, this is a very specific situation that has a lot of things that could be done. But with every one of my moms, when we have something like that, I always say, okay, first of all, when we have a big issue, we need to think about the big picture to make our plan. And so the first would be with the family, and for this mother herself, why am I doing this? Like, why are we choosing to do something that is going to put strain on the family? And this is obviously really important for the whole family to understand, because we handle hard things when we know why. When we do not know why, hard things are impossible, and they can really tear us down because we don't see the purpose behind it. And so there is clear purpose. And I know I'm guessing in this person's in this person's specific situation, there is a lot of thought into this choice, and the decision was not made easily. And the decision was made because there was a big why. There was a big why for a potential for a difference in the outcome and the longevity of this member of this family. And so understanding the why, and it's important for you to know that, and maybe even have it written down. And
Yeah.
this is, coming up with, this is the family's mantra for this next 100 days. And this is the why we're doing this. And it's for this individual. And it's because we are hoping for X, Y, and Z. And so we're taking this chance. So that's the first thing. The second thing is, with that big overarching umbrella as to why, what's our plan in the middle? What are the ways that we're going to stay connected? If there is a separation between the family, how are we going to use the internet? Because again, I have lots of families who don't have family here, and they're going through hard times. How do we use the internet to keep those connections open? How do we, is this mom going to stay connected with her children via, she's going to call each of them every single day, or are they going to be confined together, and making those plans? What are going to be the most difficult things to be without during that time? Friends, connections to the outside world, etc. So what are the pressure points, and then addressing each of them. This mom, I'm sure, knows those 4 other kids, and even the one going through the treatment best, And so that mom probably knows what are the pressure points, and then trying to make a plan for each of them as best as you can. Then the most important thing that I tell every mom, every family, is you take one day at a time. And sometimes the best thing is to not try to imagine the whole experience because it's overwhelming. It's one day at a time. And I had a mom who was a very good friend of mine. Her husband was a very good friend of mine, and their daughter, at the same age my daughter was 18 months old, got diagnosed with a brain tumor. And they were over in Switzerland, away from family, but the medical care was great. There was a great center, so they chose to get her treated there. And because of her surgeries and then following radiation and chemotherapy, she was in isolation with an 18-month-old for month after month after month. And I know it was at least 3 or 4, so somewhat like what this mother we're talking about is going to endure. And I remember thinking, as I'm sitting there with my 18-month-old, who I'm trying to keep her still for an hour during a church meeting, of how this mom and was trying to keep her 18-month-old daughter comfortable when she's going through horribly painful things, entertained when she has a room with 4 walls, day after day. And I know that was her focus, but what about her? What about her needs in that moment? And so it's important, to take it one day at a time, and also to ask for your needs when you know you need a break, when you know you even need a second just to stay in the shower for 30 minutes, to ask for that break. Because as we all know, moms are the CEOs of the family. And so for everything to go well, our moms need to be well taken care of. And that mother is doing well, and her daughter is doing well as well, and I think turned 11 this month.
Wow, that's awesome. I love that. I love everything that you just said. And you mentioned a mantra. Do you have a mantra that you love to share with your patients, or one that keeps you going?
Oh, well, I think if you ask my patients, like, the most common thing I say is focus on what you've done, not what you haven't, because we do too much of that as women. I also make sure that they know, so they can pass this on to the other people in their life. Happy wife, happy life. And so when we are well taken care of, everybody in the family does better. And then I already said comparison is the thief of joy, which is one that we talk about a lot.
Yep. One thing I tell my boys is we are stronger than life is hard. So this is something I can
Yes.
apply to myself now. Stronger than life is hard.
Yes.
So
That is so true.
awesome. Well, going back to your practice, what have you enjoyed most about Women Made Well or starting your own practice?
Man, I think to be perfectly honest, there's a lot of things about starting your own practice that I've loved, but to be honest about what I have loved the most about this experience is what I've learned from women. I have had a lot of moments in the last, like, 5 years where I've been like, "My goodness, what is going on with society, with the world?" And these women who come and sit on my blue velvet couch and talk to a woman they don't know, and they come because they want to be better mothers. They want to be stronger. They want to figure out how to care for their child or grieve a loss of a child. They are so incredible. And there were times when they will walk out of my office, or I'll shut the computer from a telehealth, and I will openly sob. And it is because of how incredibly strong the women of this world are, and how fiercely they are fighting to raise and honor the next generation. And it makes me honored that they trust me. It makes me stressed a little bit to make sure I'm helping them because they're putting their trust in me. But I think I had no clue. I had no clue the strength of women. And I mean, obviously, like, my whole career is in women. I think they're amazing, but I had no clue because I've gotten to be taken into the deep chambers of a lot of their souls and see a lot of the histories that they've been battling to come out of and to change generational problems. And that has been the greatest thing that I have experienced. And it has just made me even more driven to do more to make sure that these women are heard and given the chance and know that the work that they're trying to do is worth the effort they're putting into it, like so worth the effort they're trying to put in it.
Yeah. What's been the most challenging part of running your own practice?
The most challenging part is always just figuring out like the business side of things and trying to figure out how I can still keep the lights on, but just sit and talk for 2 hours instead of moving on to the next patient. And that's kind of been my problem for my whole career. I wish I'd say I can't even tell you. And if any of my patients are listening, they know that I've said I could spend the whole weekend with you and we would just love to like book a spot at the Phoenician and sit by the pool and talk everything out. But that's the biggest problem, and that's a good problem to have.
Yeah. We should do retreats with Candice Wood and Women Made Well.
I would
Really,
love
I think
that.
we should.
I would love that. I would love that. It would be incredible.
Candice, what are the biggest links you see between emotional health and physical healing in women?
Wow. They're so interconnected. I mean, and that's why a lot of patients come in with physical symptoms and we find that it's actually because of their depression or the anxiety, but they're real symptoms. And if you're out there, like your heart palpitations, they're real, and your stomach pain, it's real. But it can be brought on by emotional feelings that are just so intense. What are emotions, and especially anxiety and stress? Those are emotions we're having to get our body prepared to keep us safe. And so if we are constantly in an attack mode, we don't have time to heal. Our body doesn't have the energy. The effort in our body is not being put towards healing. It's being put towards keeping you alive and keeping you safe. And cortisol is running through, amping through your body. And so when we aren't doing well emotionally, our body doesn't have the capacity to heal physically. And so when we can get back to the baseline where we're in control of our emotions, again, I don't want emotions gone. I talk a lot about that with patients because they think when we're talking potentially about going beyond therapy and adding potentially medical therapy, patients are very scared that my goal is to turn them into a zombie or that they're going to lose emotion. And no, when you should be stressed, I want you stressed. What medications can help with and what our goal is with therapy or medication is to allow you to handle those emotions appropriately so that your body is still able to function and to help you through the healing process, even of an emotional diagnosis. That's a healing to allow you to emotionally move through it and be prepared to do what's needed to carry on after that diagnosis.
Yeah. So, is there a situation, or have there been many situations where you've recommended medicinal intervention? Is that something you do a lot in your practice, or do you try and steer clear of that?
Um, it's always patient driven. I think I'm super conservative as far as interventions go. I'm always going to go for therapy first, and especially in line with grieving and adjusting to diagnoses. There is a place for medicine, and it's a really big place. And I feel like I use it most when the symptoms, the depression, the anxiety are debilitating. It's keeping a mom, a family member, obviously mine's typically a mom, from being able to function at her most core duties. And when that's the case, therapy works. It works. The studies show it works, but it takes time. It takes time and it's a lot of effort. I have patients who come and say, "You cannot give me homework. Like I can't do anything else." And so I can't ask patients to do a lot of things. And so sometimes I need medicine to give them the space so that they can do the healing. And just told them on this on Thursday. It's like, I think we need medicine. I don't think it's going to be permanent. I'm thinking 6 months because I need to get the space for you to do some of the work so that you can do this on your own.
Yeah.
When it comes to grieving, I find it rare because I actually believe grieving a loss and grieving a diagnosis is a very natural process. And if you aren't functioning well, I don't jump to meds right away because I actually want you to grieve. I
Mhm.
want you to feel those feelings. I want to work them out because I really think that is the key to healing. When I just put a Band-Aid over it, I think it's going to come back to haunt all of us later.
Yep. Yeah. And it's hard coming off of some of those medications.
Yes, I try to steer clear of the ones that are harder to come off of because my goal is always to come off,
Yeah.
almost always.
Um, so how can women advocate for themselves when their emotional well-being feels overlooked in appointments?
Oh, and I think that probably happens a lot. And it's not necessarily because their providers are not good providers. It's because of the essence of insurance and the tight schedules that doctors need to keep in order to keep the lights on. It's difficult in today's environment, but I do think it's important. And so you need to advocate for yourself because that actually is the key to your healing. And sometimes I think some doctors don't realize that. And so, how do we do that? You need to ask for it. And you need to say very clearly, I need somebody to talk to. I need direction to a support group. I need I need help. I'm not emotionally doing well. And sometimes it's important too if you do have a connection with that doctor. This is a very different experience, but I did have a patient friend who was struggling after a poor outcome, and I knew her doctor. Her doctor had no idea she was struggling, and I knew a lot of it was that just hadn't been closed, the experience with that doctor. And so without her knowing, without the doctor knowing, I just said, "Hey, I saw your patient. She da 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 da. I think she'd really appreciate a call from you." He called and she completely changed. And so if she had known that she could advocate for herself and make that appointment to make that connection herself, but I think that's important. If you know that something's gotten resolved with your doctor, advocate for that. Say, I can we make an appointment just so we can talk about the delivery, that we can talk about this diagnosis further. We can talk about how a lot of times I see potentially that the diagnosis wasn't made as quickly as maybe the patient thinks it could have been.
Mhm.
And that's a really healing discussion to have. We as physicians overall really do want to help people, but sometimes we need a little help knowing what our patients actually
Absolutely.
need. So speak up and ask for it. And if they don't have the answers, ask them to try to help you find them, and they usually have a staff member who can, like, be helping looking into social the things that the state offers, and also in Arizona, you're probably the best at this, but there are some great resources at PCH that help with fetal diagnoses that will connect you to the bigger and more specific things to your specific issue. And that's, I've leaned on that a ton because we as physicians are not experts on all of the diagnoses that our patients come across, like, not possible, but
Yeah.
there are people out there that are.
Good. All right. And we have a lot of moms just in our rare disease community that are so good at that. And
You
they're examples. No, no, I've learned from others. I watch them speak up and it gives me the courage to speak
good.
up and handle situations differently. I'm getting better, but one mom in particular, she's so good at it. And anyways, so I admire a lot of the moms in our circle. So,
Good,
what are the
good.
risks when emotional and mental health care are delayed?
Wow. I feel like it's basically like if you're starting in a hole, the hole just gets deeper and deeper. So that climb of getting out, I'm remembering when we climbed the Grand Canyon, being down at the bottom of that hole. It's a big climb out. And if we can catch things earlier, it's incredible how much easier the climb out is, how much quicker the healing process goes. But when I have a mom who is anxious and the anxiety feeds on the anxiety, uh, I got I've got layers thick to unpack versus
Mhm.
if it was recognized at the start, recognized where it was coming from, and the actions to control it were taken right away. It's easy to unpack and it's an easier problem to fix. And it's the same thing with depression. And so, sometimes a lot of us believe that if I just give it time, I don't need to talk to somebody. I'll just keep waiting. Yeah, can that work? But most of the time when I speak to specific moms about that, it's a 2-year process where there's a lot of guilt about what they missed out on and had the different level of a mother because of that they were for those children during that time, because they weren't able to, function at the capacity that they usually do. And so and then the other thing is, honestly, it's miserable to live in those
Mhm.
circumstances, as yourself. There's no happiness, there's no joy, there's no peace. And so I really like, and that's one of the reasons why I'm trying to do so much with what I'm doing, because I want people to know how normal it is to struggle, and I want it within the grasp of everybody. That's again why the podcast, and why I've tried to make a course so that people can have access to it, where it's hard for them to make the appointment, or potentially they don't have the money to pay for expensive therapy, that they can get that, reach out to it, feel like they're not alone, and start making progress before the hole gets deep, and before they miss out on anything that they don't want to miss out on.
Yeah. That mom guilt is real.
It's real.
Absolutely. Yeah. And that's why I love listening to your podcast. It's so encouraging and it has so many good gems of advice in there. So for those of you listening, it's called Women Made Well. If you haven't listened to it or hopped on, please do. It's so good.
You're so kind, Erin.
Yeah. Um, so a couple more questions before we wrap up. What advice would you give an advocacy group like ours trying to work more closely with patients and care providers?
Wow. I think, making sure, which I'm sure you have, that you're findable on the internet, because again, it's rare. And so, but that's for your specific disease. But I think getting out to, on Facebook, Instagram, so it's easy to find. Your podcast is great. But then I think in the individual cities where you guys have members in, making sure that pediatricians know, making sure, as obstetricians, we always would love to know too, but I think a lot of times, especially, you can tell me your diagnosis is made, the obstetrician's long gone. But that pediatricians know that you guys are out there, that the big hospitals that handle the treatments of
Mhm.
your diseases, that you guys are top on that list of our fetal care coordinator. Like, she needs to know about you guys so she can refer right away. And I think mainly what you're doing is what needs to happen. Like, you're doing the podcast, you're getting out there, you're making things that were taboo and not talked about common. And I think that it makes, with the rare diseases that you're dealing with, all the way down to some more common ones, what you're doing is making a community for these women so that they can find the answers and the support they need. And the things that you guys are doing, you're already doing all of them. You're making yourself accessible, and that's what you need to do.
We're trying, but thank you. And then for those listeners right now that are dealing with emotional pain or trauma or a scary diagnosis, right now, what would you like to say to them directly?
Oh, the first thing, like we talked about before, is breathe. Take a deep breath and remember that you should feel something. And it might feel really, really heavy. And it might feel, I think sometimes the hardest thing is you feel guilty about how you feel about these things. Because when it's your child, you feel like you should be fine with whatever. And you shouldn't be disappointed. And you shouldn't be upset because it's your child. And you shouldn't feel that you were robbed something. But I think all those emotions, the grief, grieving the expectation of a life that you maybe had for this child, or the expectation of the life you guys were going to have as a family. Uh, those are real feelings, and you need to grieve them. I had a very sweet mother that I just delivered her baby. I was not her care provider. I was just there that day, and she was having twins. And we delivered both the twins. And one of them, it was pretty evident from the nurse after I passed the baby off that she had some clear signs that she had Down syndrome, and the diagnosis was confirmed. And I remember talking to that mom the next day, when I rounded on her. Such an amazing mom. But what she said to me was, "I'm just so upset that on my daughter's birth, I was crying and I was grieving when I wish I had been able to figure out the diagnosis before and get a handle on it." And I love her, and I'm so happy she's here, but I was upset that I was grieving when she was here. And I assured her that was totally appropriate, because like I've told you before, I think trying to hold back emotions is not the right thing. It's we just
Mhm.
don't want to, as one of my patients says, unpack and stay in them. Don't get comfortable. But this mom was grieving an expectation she had, and that's appropriate. And so feel the feelings that you're feeling. Talk to somebody that you feel safe with about them. And that's where someone like me comes in, or a trusted friend, because you might not want to tell your partner your deepest fears because you think that's going to feed his or hers.
Mhm.
But you need somebody to talk to about those fears, because you need somebody to tell you that's a tomorrow problem. That's not likely going to happen. That's relevant. And let's dive deeper into that. You need that space. And so I guess my best advice is allow yourself to feel the feelings and do not feel guilty for them. If you're going to be the care provider for this child, you need to be at your best strength. You need to be in the position that where you're prepared to take it on, to where you're prepared to have that mindset that you're going to continue each day and just try and see if this works, see if that works. And then, in the words of Anna from Frozen 2, you just do the next right thing. And if you go back and you read those words to that song, it's actually pretty powerful. She talks about how when she looks at the bigger picture, it's too much to take in. The whole idea of this life and how you're going to make through your current family, the addition to a child with an issue, et cetera, et cetera. It's too overbearing. It's overwhelming. You can't handle it. And I know that's how so many of my moms feel. You can't do that. But you do know, and she knew, and I know each of these moms, each of these families, they can do the next right thing. And I know, Erin, that's exactly what your family's doing. Then that's all you can do.
Yeah. I love it. I love it. You spoke about um, the book that you recommend earlier. Are there any other books that you recommend for moms?
Oh my goodness, there's so many. I mean, I have my favorite books that are like for new moms trying to figure out how to take care of their babies, those ones. But for more the mental health aspect, and it's funny because none of them are like related to moms at all. Like mindset has nothing to do with motherhood, really.
That's
Um,
okay.
Another one I love is Let Them, which is, hot right now. And if you haven't heard about that, you definitely need to dig into that one. That's by Mel Robbins. It's phenomenal. Talking about taking back the control in your life and stopping comparing yourself to others, or letting other people's reactions to you define who you are. Oh my goodness, it's so powerful. And I had a woman who I suggested to a lot of people after I had read it, and she came back and she's like, that book has changed my life. And it's true. Because if you apply it to your life, you will regain so much power back into your life, and which will allow you to reach your goals. So that's another phenomenal one. I really like that one. For grieving, I love It's Okay to Not Be Okay. And grief, I apply to a lot of things. I apply it to getting a diagnosis that's different than what your expectation for your child's life was. And
Yeah.
so that's a great book, and it's written by a psychologist who had a very tragic experience, witnessed her husband die. And why I love it so much is she said in the first chapters, I felt so guilty for all the advice I'd given my clients before. It was a load of trash. I wanted to reach back out to all of them and tell them, I failed you all. Because once she'd experienced it herself, she was like,
Mhm.
I served them so poorly. And when, as soon as I read that, I was like, dude, I'm finishing this book, because that's such a powerful perspective to have the science behind it, but also the personal experience. And then to realize that the science fails a lot of the time is a really important perspective to have. And so I do love that book too.
Awesome. Awesome. We'll include all those books in the show notes too.
Awesome.
Okay, one last question. Your guilty pleasure after a long day at the clinic.
Oh my goodness. I just want to sit on the couch with my kids, and I wish, which it doesn't ever happen, that dinner just magically appeared. That hasn't happened yet, I hope, and it maybe if my husband listens to this podcast, it will.
Yep.
But yeah, I just love to be on the couch, and especially after a day in my clinic when it's a day dealing with difficult topics like what we're talking about today, or just difficult topics where mothers are really fighting to take care of the kids that they love, but they're really struggling. Like it's so healing for me to just like sit on the couch, let it go, and be with my own children, which I think the love and desire to serve them well is really the motivating force behind my whole life outside of their home, is because I just love them so much, and I want every mom to have that same experience, and I want every kid to feel that. Because I'm preaching to the choir, but that's the difference in
Mhm.
all the outcomes. A child that feels loved and safe and stable in a home, it makes all the difference for their future and their ability to achieve and reach their potential in this world. And it's like there is no greater honor I
Yes.
could ever have in this life than to be loved by my children and for them to reach their potential. No greater
Absolutely.
happiness could be given me.
All right. Well, thank you so much for joining us today, Candice, and sharing your work and your mission with us. Women Made Well is exactly the kind of care that we wish every mom in the rare disease community had access to. For those of you who are listening, all the books that she mentioned will be included in the show notes, as well as her podcast and her website, everything on Women Made Well. And remember, whether you're advocating for your child or for yourself, these kids and these women can't wait.
Thank you for joining us on These Kids Can't Wait. Every story shared brings us one step closer to awareness, advocacy, and action. If you've been inspired, please subscribe, leave a review, and share this episode.
To learn more about the Lost Enzyme Project or donate to the cause, you can visit our website, Instagram, or Facebook page. Those links will be provided in the show notes below. Thank you again, and remember, these kids can't wait, but together, we can make a difference.